and I have, over the last 7 years, I've done probably like maybe 50 of these that are all there too. So if you want to kind of get into some other topics, then lots of, me talking about what I'm interested in. So that's there too. And I have some business cards over there. There's a little kind of trifold or wrap card about our clinic, and a little list to sign up for our listserv. We do lectures, we do group detoxes, we kind of do community outreach in various ways, and so if you want to kind of be on our thread, that's awesome. So I'll introduce myself. I'm Dr. Hunter Peterson, and I'm the Clinic Director of Correlating Healing Arts. And this get-together is called Open Forum, and it's called Open Forum because the reason I'm here is I really want to get into a conversation with you all about what you're interested in talking about relating to health and all things. And so I found early on that it was nice to come with a topic to kind of spark interest and kind of say, I want to hear what his perspective is on that, but that's very loose and is more of a backdrop to the conversation. So I like to really begin each of the open forums before launching into a topic, to kind of take the pulse of the group and see what you all are interested in talking about today, learning about, discussing. And it can be all ranges of topics. It doesn't have to directly pertain to the kind of, area of immune health that I presented, but I'm assuming where we're at in the world right now, there's probably quite a few questions around that, and this is the chance to just go at it. So I'm going to open the floor to anybody who wants to share about what they're interested in, connecting about tonight. Any questions, or want to start us off?
I've got a vitamin D question.
Okay, yeah.
Immune response and all that.
And
to do with immunity?
yeah, how does vitamin D,
Well, from what I've been doing the last couple of years is I've been taking vitamin D 5 drops every day because supposedly it was helping the immune system. But I hear more about it to do with how much sun you're getting.
Yeah.
So
Yeah, I was going to talk about vitamin D, and I can just expand that out a little bit as we talk through the topic. By the way, I've also decided over the years that going through these questions at the end of the talk, in case we're running over, so if people want to scoot and they're like, no, I'm good, then we can skip it and just take off. So I'll accumulate all this, plus a lot of the questions I'll end up covering during the talk. Yeah, what other questions are there?
I'm going to call out the elephant in the room.
Yeah.
Well, how does our immune system respond to this new idea of vaccine, mRNA?
Oh, okay.
Do you have any information on that?
Yeah,
Okay.
I can bring that up in the talk probably, and if it doesn't come up in the talk, then I'll make sure at the end to cover it.
And there's also a new one that's coming out. I think it's Novavax. That's not mRNA. I'm not really sure. It's like,
Yeah, I'm not as familiar with that, but I basically only allow myself the bandwidth to research the stuff that's out on the market because that pertains to my patient population in real time, and I can get lost in it, so I probably can't comment on that one, but I can talk about the mRNA science. What other questions?
So what about our microbiome and heal on our belly? We have all kinds of belly issues.
Like in what kind of pieces of that are you hoping to kind of tune in about?
Leaky gut, healing,
Sure.
bacterial imbalances in the belly.
Yeah, so,
No absorption going on.
okay.
Anything else you can touch on the microbiome in the belly?
Yeah, sure. It's a big topic, but I'll get, into it a little bit.
What's that?
Okay. What else? Yeah, okay.
Seasonal eating.
Seasonal eating, sure. Yeah, I can mention that. Yeah. Go ahead, Andy.
So I have two questions. One from a friend who had a botched biopsy yesterday and she couldn't get here. So is that kosher to ask for somebody else?
Sure. Botched biopsy, just can you clarify?
Oh, it's not related. I mean, it is related, but it doesn't matter. She just physically, she lives in Spokane, she couldn't
Oh, no,
travel.
but in terms of what about a botched biopsy, like what to do about it?
No, the question, I'm gonna tell you the question.
Oh, okay,
You're saying
good.
she couldn't physically
Yeah,
heal
sure.
herself because she
Yeah,
had
go
it.
for it. Yeah, what's the
So
question?
she's got endo stage 3,
Okay,
and her rectal wall is being pushed by the endo, and it's possibly growing into the wall.
okay.
And so they want to remove the uterus to make it safer to excise the endo tissue. I know this is a little
Yeah, this is pretty specific.
well, but I'm going to make it kind of, anyway, I'm almost
Go for it,
So she also has, and I don't know how to say this, adenomyosis
Yes.
on the uterus. So
Okay.
it's painful during menses,
Okay.
but she really doesn't want to lose her uterus. She's with that young woman whose name I won't remember in Post Falls, who's actually really great and fairly progressive, just in case for context there. So she's understanding the uterus to be an important part of her structural integrity and cycles, and if it's taken out, doesn't it affect all the other organs, sexual pleasure and hormones, and her overall balance? So that's the first part of that question, and the second is, do you think at this level of complexity and how far it's gone that you can, she's signed up for a new patient in June.
Oh, yeah, but it's kind of a pressing issue.
Yeah, she signed up for surgery at the beginning of July, so
Okay.
she's kind of, and do you think you could still help it, even though it's this extreme now, or?
Yeah.
Yeah.
Age is what?
She's almost 50,
Okay.
and she's had lots of other female problems, I could just say, 3 kids and blah, blah, blah.
Okay, I'll just answer that one real quick because there's a lot of info you're putting in there. So looking at all of like the workups and surgical reports would really help me be able to more like confidently answer some of those questions. If the question is, can it be addressed in a meaningful way in 1 month? I mean, absolutely not. This is a long-term process to reverse it non-surgically. And in terms of like removing uterus, what is that going to do? The fact that she's so close to menopause, it becomes a lot less problematic. In terms of the pelvic floor and the muscular, repercussions of that, that is significant. But again, all of the process that's probably been going on for many years is already going to be creating a lot of dysfunction in those tissues, and so that it's not. Again, the bigger concern with removing the uterus would be if she's in her 30s and you're really dysregulating the hormonal systems for 20 years before you would really want to be. So, but I mean, I've had a lot of success reversing endometriosis. Adenomyosis is a little different process, a little different, kind of causative forces. So.
She's in so much pain that I think that's the nervousness around not doing the surgery, and it's been for a while, 3 years, so.
Yeah.
So that's plenty, thank you.
Yeah, okay.
And then one question for me.
Yes, okay.
So, I usually just have that yearly session and I come all prepared, and I had all that, forgot because I canceled my March appointment and didn't come for 6 months. So really the primary symptom should have been the loss of memory, but I had it even on my paper. Anyway, it's the whole skin issue, right? So I completely forgot that, and I'll try to make it simple. My challenge is, which I've experienced over the decades, is having the allopathic and non-allopathic physicians, communicate and cooperate, and me not stuck in the middle. So Sears, I told you wants to do 3 things that I don't really want to do, and yet with already basal cell melanoma and non-history melanoma, I'm trying to be, walk the middle ways somehow. And so it might have to be in a session, but I just thought, it's.
Well, why don't you hang around after and we can talk
Okay.
about it a little bit. Go with that. Yeah. Okay. Thanks. What else?
Yeah.
What else? What other questions? Can be very broad too. Can be very specific. Yeah.
Cardio exercise versus weight training.
Okay. Yeah. And in terms of the merits of both, and like what about them, and like what's optimal?
Yeah, what's
Okay.
optimal?
Optimal balance. Okay. Cool.
Actually, I'd like to expand on that, of just exercise in general, like how much, or, yeah.
Sure. Yeah. Yeah. Talk. Give some thoughts. It's going to be a very individual answer in the end for each person, but I can give some platitudes. Yeah. Cool. What else? What other questions are there?
Supplements.
That one will need to be more specific.
The most important ones to make sure you're getting, I guess you have vitamin D in there.
Yeah, sure. I think I could turn that into a question like that I could answer in a specific way that's more general.
You had that great list, you know.
Yeah, I did do a lecture one time on like the 10 best ones. I don't know if I recorded that lecture. I can kind of draw in on a few of those too, as
I
well.
have a list, you could still have it on the site.
Yeah, that's true. I'm so individualized about care that I would kind of cringe to put something out like that. But okay, yeah, I can go over that with you a bit. Anything else? Any topics? Anything like that you want to make sure I talk about in regards to coronavirus and vaccines and like, you know, because it is a lecture on the immune system. I'm not just going to like make it all about that, but I would assume people are interested. So if there's parts of that besides the vaccine question or Mrna that people are interested in, happy to make sure I catch it. Go for it. Yeah.
I am curious as to what, how to boost the immune system during seasonal allergies and the effects on us, and what we can do to help.
In addressing seasonal allergies. Sure. Yeah, it's actually the opposite, how to calm down your immune system.
There you
but
go.
we'll talk about that. Cool. That's a good one. Good timing. There's any others? Okay, so I'm going to leave our list and scroll back to it, and we'll catch hopefully some of these during the talk today. So the immune system. I like to start the conversation out by really zooming out and understanding, you know, a system of our body it's really important to how we navigate the world. It's always been for all animals and humans that infectious disease is something that can end our life prematurely. We're no strangers to it. We're constantly engaging with it from the day we're born to the day we die. And our bodies have developed very elegant, intelligent systems to make sure that pathogens that are unfriendly to our system, that are going to create harm in our body, can be removed and identified and removed. And so one of the major players in that is this organ system called our immune system, which is not a specific organ that's in one specific location. It's actually everywhere, inside of us, outside of us. So it's a diffuse organ system in our body, but it plays a major role in our health. Without it, we wouldn't be able to live. And even in a very compromised state, we know how dangerous it is to not have a well-functioning immune system. And so the way that we're going to really get into the immune system today is through the lens of infectious disease, and specifically through acute infectious disease. And so the differentiation of that is there's a lot of different kinds of infections that can kind of smolder in our body and linger for a long time in our body, like Lyme disease or Epstein-Barr virus, viruses, bacteria that can be kind of coexisting with us, gut infections that are more prolonged, We're not going to be talking about those as much. We're going to be talking about acute infections. And what I mean by that is typically something where an infectious process develops in our body really quickly and typically will resolve quite quickly or you die. I mean, to be really blunt, is kind of how acute infectious disease works. And again, up until the last, I guess, 100 years of human history, acute infectious disease was the leading cause of death by far for humans. And now it's actually a very, very small cause of death, especially in developed nations. And it's been overtaken profoundly by chronic diseases, which are much slower and arguably involve a tremendous amount more suffering because they go on for a lot longer. And so most of the lectures I will be doing here and most of the work I do with people in the clinic is chronic disease, not necessarily infectious. But that doesn't happen to be what we're talking about today. We're going to really tackle this other subset of things, which nevertheless we all deal with in our lives. And so in that conversation, what are we actually talking about when we're talking about infections? We're talking about microbes that live in our environment and we can't see them. They're microscopic. So it's a tricky, thing to relate to because it's hard to understand something you can't see. But what we're talking about specifically are very small organisms. We call them bacteria, we call them viruses, we call them fungi or fungus, and parasites. And they all live in harmony with us, and they always have. In fact, we wouldn't be able to exist without them. They live within our body, especially in our gut, but on our skin, on all of our mucous membranes. We actually rely on them heavily when it comes to our gut. And so it's this balancing act we're playing with these microbes continuously of, all right, these ones are helpful, these ones are kind of neutral, these ones cause problems, these ones that are kind of neutral, if there's too many, they can cause problems. And so it's interesting, right, to talk about it in terms of our more public health paradigm is like, oh, microbes are bad and they hurt us, whereas really we're constantly in relationship with them from day one of our life when we're born sterile but then come out of the vaginal canal and get inoculated with all the bugs in the vaginal canal, and that begins things and it never ceases from there. So, the microbiome, I think, conversation, we could just go off for hours and hours on that, and it's fascinating and it's really powerful information. And in a way, we're going to talk about that because that microbiome influences acute infectious disease in terms of how our immune system is wired and responsive to pathogens in the environment. But for our purposes, we're going to talk about these rapid onset microbial invasions into our body that then turn into a situation where our body, our immune system has to deal with it, clear it so that we can go on living and make a full recovery. And in that conversation, we want to talk about these different ways in which, okay, well, how do we become infected, right? What does that mean exactly? We'll just say, for our purposes, infection is the symptoms our body makes to deal with the acute pathogen exposure that's happening in our body. And so there's a theory of how that happens. There's actually two prominent theories, and we're mostly familiar with the one theory that's the default narrative of our conventional allopathic medical system, which is called the microbial theory. And the microbial theory was, Louis Pasteur was kind of the initial scientist who everyone's probably heard of, who also was the first person, I think, to come up with vaccines. He also posited this theory that said that an acute disease is caused by exposure to a microbe. So if you have the microbe present, then that's what's required to create disease. So it's kind of like, again, the microbial theory is just microbe, and that's bacteria, virus, etc., equals disease. So if you have this, then you develop this. So that's the model that we work off of, and if you think about like coronavirus pandemic is such a good example to demonstrate this and how we've treated it, it's that, okay, well, if you're exposed to a microbe, you're going to get disease, and so what do we got to do about this? Well, we got to protect and prevent ourselves from being exposed to the microbe. So we put masks on, we don't go to large gatherings, we put filters in things, we distance each other, we wash our hands a lot, we don't touch our face, right? Really good public health information out there about this. And it is good information. We could get to talking about, you know, masks and the more political part of that, but we don't need to. The bottom line is they all make sense for the most part, and they all reduce our potential to be exposed to pathogens, which this theory says, okay, if we can get rid of the exposure, we're good. My challenge to that situation is, you know, right now we're breathing air that has, you know, millions of viruses and bacteria floating around in it. Yeah, thanks for closing that. And so if it's literally impossible to avoid exposure to microbes, then how is it that we're not all sick, right? I mean, that's just a paradoxical question. I'll go more into that. So that's the microbial theory though, right? The other theory is made by a scientist who's not nearly as famous, but he's my guy. His name's Claude Bernard. He was contemporary of Louis Pasteur, and he came up with what's called the terrain theory. So what his theory posited about infectious disease is that in order to have disease, you need to have the microbe present, but you also need to have a susceptible terrain. So if you have both the microbe and the susceptible terrain, then you get disease. You don't have the microbe, but you have the susceptible terrain, you don't get disease, right? So, like, again, you know, like that first theory works great there if you're making the assumption that there's no exposure. And again, if you decided to lock yourself in your house for a couple of years, you probably wouldn't get very many acute illnesses. You also would be a pretty unhappy, maybe even psychotic human beings. We need social contact, so that would be tough too. But you can have a susceptible terrain but not have the microbe and you're not going to get disease. Equally, you can have the microbe exposure but not have a susceptible terrain to that microbe. And Bernard would say, and the terrain theory would say, you're not going to have a disease. You're not going to create a disease. And so when we're having a conversation about infectious disease, this is what I think we really need to mostly be talking about, is the terrain, the susceptibility, the predisposition to actually develop that infection when an exposure is present. And so that theory really plays into the central dogma of how I practice medicine from the framework of both acute and chronic care. And this dogma is also really powerful in the kind of the philosophy of prevention. So again, you know, isolation from exposure, pretty brutal lifelong thing to adhere to, right? Imagine never holding your baby, never kissing your spouse, never doing all the things that really like make us happy and make us alive. That would be prevention for this model. So prevention for the terrain theory is, I think, a lot more palatable to me because it's about taking accountability for our own health and recognizing that there are things we can do in our life to reduce our susceptibility to harmful pathogens, to alter the soil of our body, to use a metaphor, or the terrain of our body to reduce our susceptibility to illness. And so that, to me, is of utmost importance. I mean, take this example. I like to tell this to kids sometimes who get sick a lot and we're treating them for this. Like, Well, think about you got this big smelly bag of trash, and you get all these flies buzzing around it, bees buzzing around it, and you really don't like those, and they really bother you, and they sting you, and they hurt, and they bite you. So what are you going to do about it? Well, there's basically two things you can do. You can buy some bug spray that's really toxic, and like if you breathe it in, it's probably going to hurt your lungs, and it's going to mess with your gut. But you could kill those flies and bees, and they would be gone for that moment. And that's one thing you could do. Or what if you just took the trash out? What if you just got rid of the trash? And then what would happen is the bugs and the bees and flies would go away. They wouldn't be there anymore. And so that's kind of like, if you wanted to boil it down to the simplest paradigm difference between conventional care of infectious disease and naturopathic care, that's it. You know, I'm going to talk to people about taking out the trash, and we're going to have a better, more permanent solution, and all these other health benefits come around from not having trash around, and you're not going to get sick. Or we could just keep using the hostile chemicals to keep killing the bugs and seeing how long that they can stay away for, but the more we kill them, the more weakened we become, and the more kind of chronic the situation is, and the more unhealthy we get. And that's, you know, the metaphor for the sprays is antibiotics, right, or antifungals. We actually don't even, in conventional medicine, have very good tools against viruses, which is why, you know, the current situation is pretty tough for our conventional model, because we just, you know, they haven't developed drugs for that, and that's the tool that's available to conventional medicine. So that differing approach, again, just the terrain seems like such a better force to work on, and there are so many facets to that we can engage with. So one of the things about the terrain that I'll say is it has a lot to do, the terrain, one of the big parts of our terrain is the vigor and intelligence of our immune system, right? Like that's a big part of our terrain that's a modifiable variable of our health. So I want to talk about the immune system a little bit more in depth in terms of how that organ system works in our body, because I think it's a good backdrop to understanding what our body does when exposed versus when it's infected, and what things are activated to take care of things. Before I do that, I want to make sure that everyone is good with these topics, these concepts. Any other, you know, clarifying questions? Yeah.
How do you spell it?
What?
Terrain.
T-E-R-R-A-I-N.
Oh, so like terrain in the field, or?
Yeah, like your terrain, like the terrain that your body inhabits. You could use the soil too, but it's yeah, that's what it is. The word you know. Anything else? Okay. So then let's just do a little dive into the immune system, because this is where we're going to catch vaccines a bit too and understand those a little better. Two main parts to our immune system, you know, again, which is jobs to identify and clear pathogens that aren't supposed to be in our body, or that it determines shouldn't be in our body. That's interesting. We could talk about allergies in relation to that too. So there's the innate immune system, which is non-specific. It's parts of our immune system that will respond to various viruses, various bacteria, fungus, parasites. And it's an immediate response, and it's always present. These components are our innate immune system. Versus the adaptive immune system, which is the other main arm of our immune system, which is a more delayed response part of our immune system that has the capacity to create a very specified, individualized response to a unique virus, to a unique bacteria, to a unique fungus. And so that part of our immune system, again, is very important, crucial, and is a more delayed process that I'll explain, is also the place where we get to talking about vaccines. But let's talk about the innate immune system briefly. So our body actually has an elegant array of very outstanding tools to prevent microbes from setting up shop in our bodies. Our skin is a barrier, right? That's one thing. You know, like We're not constantly infected in our skin because it's a really good barrier function, and there's these enzymes and defensins on our skin that chop up microbes that land. There's bacteria on our skin that are kind of helping keep that terrain balanced, and it's kind of like a nice rich turf of grass. Like, you got a solid ground cover of grass, it's not, your yard's not going to get full of weeds. It's when it's all bare and, kind of exposed that the seeds of the weeds just pop in and start growing and thriving, and pretty soon you're in trouble and have infection. Same story in the gut lining or in any other mucous membrane lining, which is the main place that we tend to develop infection. The mucous membranes are the nasal passages, the mouth, the throat, the ear, inner middle ear, or outer middle ear, vaginal tract, vaginal lining. The gut is a huge mucosal lining in our body. And these are all the classical places where infections begin and spread. This is primarily on our mucous membranes. And so those, again, parts of our body have really good defense tools. One of the main ones is mucus, right? Like this slippery substance that's on all of our mucous membranes, which are called mucous membranes, that really makes it hard for microbes to adhere to those places and really kind of get entrenched. There is also this kind of different set of gut guard protectors, which is your stomach acid is actually a profoundly helpful tool to prevent infections seeding into your digestive system. Your stomach has a pH of 1, so it's a very, very, very hostile environment to anything, including microbes. So those are some of the real basic macroscopic tools that our body uses. Though the lungs are also another mucous membrane, obviously. Lung infection, we can talk about those, but important to mention. So then there's this part of the innate immune system that comes from the bloodstream and gets secreted out onto those mucous membranes, as well as circulates in the bloodstream. And these are, the term I'll just use, although there's many, many, many more, is white blood cells, macrophages, neutrophils, eosinophils, monocytes. These are different types of immune cells, but they, in a non-specific way, can shoot out all sorts of, disruptive compounds to blast open the cell linings of bacteria and viruses. And there's other communicating cells that help them identify that those are things you want to be blasting up. And hopefully, your immune system has enough intelligence to know what's hostile and what's friendly. And that's an interesting thing to just pause on, because for a lot of folks, there's big issues with that. Allergies are an example where an issue's come up there. You're taking something benign that's not harmful to the body, like a pollen or a grass or animal dander, and your immune system's treating it like it's hostile. That can be a big, problem for people because their immune system's always activated. And as I said, the symptoms of an illness are not the bug, it's the immune system's response to the bug. So if the immune system's responding to something benign, it can still be very problematic and uncomfortable. Another example of this process going haywire, where the immune system's not discerning self from non-self, good from bad, is autoimmune disease, which is an epidemic kind of problem in our society and world, but definitely first world countries. And that's a place where the immune system's actually started to engage with its own tissue as hostile. It starts destroying it. I work with lots and lots of people with this process going on in their body, and it's very chronically destructive. So there's a whole other lecture, multiple other lectures about how that process begins and how to address it. But it's just to point out that our immune system can go haywire just as well as it cannot do a good job fighting infections. The real thing to kind of tune into there, and I'm going on a tiny bit of a tangent, but one of the big things that makes our immune system intelligent and know how to pick up and identify the bad bugs is what's going on in our gut, and specifically how the bugs, the good ones that live in our gut, interface and communicate with our immune system. And so if the bugs in our gut, the balance of them, the ecology, again, the terrain of those bugs that are living there, are the kind that belong there and have really like good interaction with the food we eat, with our immune systems, then they're going to teach our immune system how to respond appropriately to external stimuli. And so when that gets really dysregulated in the gut, in terms of the bugs that live there and all the forces that cause that, stress and eating patterns, then our immune system does both things. It reacts to the wrong things and it doesn't react to the right things. And so it can create a lot of higher susceptibility. It can weaken our terrain. So that's a really important place where our immune system goes awry. But let me get back to our little chat about what the immune system is and the different parts of it. So basically what I said is when the immune system is functioning properly, then all of the pathogens we're exposed to in our virus, or in our environment, if everything's really functioning robustly, the immune system's going to, just kind of wipe everything up, and it's going to remove it before it even gets going and gets established. And what's also going to influence whether or not things get established is how much, soil those bugs have to get seeded and growing, right? If there's no soil around for them to kind of be germinated, then they're not going to survive. And that's really this big part of the terrain, right, is that we want to make sure the soil is inhospitable to the bugs. It's not necessarily the immune system that's doing that, it's the health of our tissues. The immune system is a part of that, but the health of our tissues and the amount of toxic debris lying around in our tissues that serves as soil for those microbes to grow, that's a big point of influence. So questions about the innate immune system, how it works, and kind of some of the constituents of it. I just wanted to give a little intro there.
I've heard that that viruses are essentially non-living and that they're genetic updates in a sense. Is that, what do you know about that? And that like as they come in, they're actually,
Yeah, so how a virus works, how it creates infection is, I think you're misconstruing non-living with non-cellular. They don't have the classic structures of a cell in terms of how science understands the basic cell unit and the components. They are not able to propagate and reproduce independently. You need like all the architecture of a cell to do that. So what viruses do is they inject themselves into other cells in our body, multiply, replicate, and then destroy that cell and then move on to another cell. And usually when they replicate in that cell, they multiply, literally they could actually create millions of new viruses. And so I guess it's a little bit incomplete for me to say that our immune system is what destroys us in infectious disease. I mean, yes, actually the pathogens are destroying our cells, and when they multiply times factors of 10, then they are going to pretty quickly start destroying a lot of our tissues and cells if we don't have something to put that in check, kill them, and combat it. And one of the ways they do replicate in our cells is they hook into our DNA and RNA and reproduce their genome and then build out from there with the resources in the cell. It's a really good point to kind of just clarify how these microbes work and what they're doing. Bacteria work a little differently, but they're often they're cellular organisms, so they're basically sequestering resources from our body, from our bloodstream, from our tissue. And as they sequester resources, they also are hostile to other tissues and cells as they expand and grow. And they, again, grow at exponential rates when they're left unchecked. So good clarification. Any other questions about innate immune system, how it works? Okay. So then the adaptive immune system is this other part of our immune system where basically when an exposure to a pathogen happens and is starting to get set up and established, then there's what are called antigen-presenting cells, dendritic cells. It's parts of our immune system that go sample the DNA and the kind of molecules on the external part of those pathogens, and they shuttle it back to these things called lymph nodes, which you're all familiar with. They're all throughout our body, and they're kind of like the meeting centers, the meeting rooms, where our immune system kind of communicates, and then that presentation goes to the lymph node. In the lymph node, there's a process of synthesis of all these different kind of immune cells that start to develop compounds specific to that microbe. And as those get developed and cranked out, they go back to the tissue where the infection is beginning, and they start destroying the virus or the bacteria or the pathogen, whatever it may be. And that's a very, again, individualized, specific process that's exactly pertaining to that microbe. And the things you probably heard of, for sure, antibodies, those are one of the components of this part of our immune system. They get created to flag and sequester those pathogens for destruction. Killer T cells are another term that many people have heard. Our T cells are a part of that process that can blow up those pathogens. And so when we talk about our immune system in general, but specifically the adaptive one too, this lymphatic network in our circulation is really important to that process, because that's how information exchange happens, and that's how we get the immune cells moving to where they need to go. And so that process of the adaptive immunity is usually the way, if we start to actually host an infection and it gets established, it's the adaptive immune system that ends up clearing it out for the most part. And so the problem with that, and why we end up being sick for a while, is that as that infection's spreading and causing its issues, and the other parts of the immune system are fighting and doing everything it can to clear it, it takes some time for that adaptive response to kick in, a few days usually. So that's why often even from exposure to symptoms is usually a few days incubation, because those symptoms mostly really ramp up when you start to have that adaptive response kicking in and driving the quote-unquote inflammation, which is what the immune response is. So you get heat, swelling, temperature raising, pain usually comes along with that. And then sometimes you'll have pus or discharge. That's like that immune tissue that's fighting and blowing up the microbes and the debris that comes out of that. That's all that process is what's going on there. So that's the part of our adaptive immunity, and where that ties into vaccines is that what a vaccine is pretty amazing concept. We learned that we could actually take basically, we call it attenuated or a partial piece of a virus or a bacteria, or even like part of its DNA or RNA structure, and basically inject that into our body, and we can develop that adaptive response without getting the full-blown infection, right? So we can make that antibody adaptive response without having to go through all the bummer part of being infected and going through what we call wild-type disease or virus or bacteria. And so the advantage there is that if you do get exposed in the future to the wild-type virus out in the community or the bacteria, that you're going to quickly mount that adaptive response, and that infection can never really get going because you quickly snuff it out. And so that is the rationale behind deploying vaccines to combat infectious disease. And that's why we've been able to cure or reduce the presence of a lot of these microbes in our world as a result of the tool of the vaccine. And in places like third world countries where we don't have good access to medical care, it's a huge lifesaver, vaccines are, because people who wouldn't have good medical care, that wouldn't have the good support of treating these wild-type infections, would actually be able to, really preserve life through having that prepped immune response. So that's really what we're in the midst of right now in regards to this COVID-19 specific virus. Is there's been a vaccine developed, it's pretty effective at creating antibodies for the microbe and therefore reducing the amount of infection and the spread of infection, arguably, of the virus. And so that's all, the good side of things, right? The side of things that aren't so great is that a vaccine is designed to elicit immune response, right? The only way you can make antibodies is if you get your immune system kind of revved up and you get those antigen-presenting cells going and you start to build that response up. Well, it turns out in some people, especially the people with allergies and autoimmune and messed up guts and that are stressed out and their immune system's all confused, that when you put this stimulus into the body, especially as an injection, you can really rev your immune system up and your immune system can kind of boil overboard and start to elicit local and systemic actions that can be problematic in their own right. And so that's the piece around vaccination that have people concerned, myself included, that this is not a panacea for infectious disease and it carries with it risk. Because we are knowingly revving up our immune systems with the supposition that our immune system is not capable of taking care of that virus on its own when we get exposed in the community. And so I've already treated about a handful of cases with very severe COVID-19 vaccine reactions, long-standing, still dealing with the ramifications of. It is impossible to do the science about the amount of autoimmune disease that's going to be precipitated, the amount of cardiovascular, asthma, et cetera, because we have no way to do research on it, and we certainly don't have a government that wants to fund it. And we furthermore have not seen these vaccines around for a while, so it's just, it's like we're all guinea pigs in an experiment in terms of the long-term activity of these vaccines. Now, for most people, you're going to have a mild response to the vaccine or minimal response, and you're through it, and you're on to life as it was, and now you have protection against COVID. I would make the argument that some of the people who have no response, they're actually not making sufficient antibodies, and we didn't do any antibody testing of the participants when these vaccines were developed to check of the 90%, 5% effectiveness of people not getting COVID, how many just didn't get it because they weren't exposed? How many didn't get it because they don't have a susceptible terrain? Versus, do they have really robust titers of antibodies that we can go test after they get vaccinated? Well, we didn't do that. So I suspect there's quite a large subset of people that didn't actually develop antibodies and just have this false reassurance that I'm protected and they're going to get COVID, and indeed we're seeing some of that too. And so then there's going to be the people way on the other side of the spectrum that are going to have these really extreme reactions, and they're going to develop antibodies, but they're also going to have major health ramifications from that vaccine, potentially. And again, that's on the periphery. So I'm not, kind of disseminating a platform that vaccines are bad. It's a nuanced conversation, and it has to do with ultimately individualizing the guidance to individuals based on their health history, their health picture, and their risk factors. Now, say that I'm talking to someone who is 400 pounds, has 5 different chronic disease diagnoses, and is 75 years old, and is on 20 medications, I'm going to say, go get that vaccine. Because you get a virus that's a little bit more challenging for your immune system to work with, then it might kill you, with how dysregulated your system is and how compromised your terrain is. That's not a big cohort of my patient population, which I'm grateful for. Those are really challenging places in the river of health to be in when you're that chronically compromised. And sadly, that's the vast majority of people who have succumbed to this disease are the people in that category. In my local community, of the upwards of 100 people I've treated for COVID-19, I've had 100% have full recoveries. 0 out of 100 need to go in for further higher level of medical care, no hospitalizations. And then there's a couple hundred more patients who have just anecdotally come in with, I tested positive, this was my disease course, and I asked them, what was your disease course? And so I think that it's another thing not disseminated that, again, I'm not saying this is true or this is false. I'm just speaking as a primary care frontline physician, my personal experience with dealing with the wild type virus out in the community. That's just a little food for thought, and my 2 cents I'm going to give to COVID as it ties into this vaccine conversation and the adaptive immune system. And another really important thing to point out is if you did get COVID and you were tested positive and you had any form of active illness, then you have way better antibodies than the vaccine could ever give you. So there is no scientific logic to me to take someone who's had the wild type virus and then go immunize them on top of it. It just doesn't follow any logic of infectious disease science that I can understand. So there's that too. Yeah.
I'm not familiar with this wild term.
Wild type means the viruses that are floating around in this room that aren't a vaccine. All the wild type means what's out in the community, all the bugs that floating in the air, in our food, in our water, in the air we breathe, in the things we touch. Those are the real deal, right? Those are the microbes. So the wild type coronavirus is just the one that is not the vaccine, modified protein spike. Yeah.
So is it safe to say that if a person's terrain is not stable, whether they're 400 pounds or whether they're a 175-pound athlete, if that person, the athlete, gets sick and he doesn't get through, he passes away, there's something else going on.
Yeah, I would say that there's this, what is sensationalized in the news, you get these little anecdotes that come in the big news outlets, the social media, the platforms. What those are, in my opinion, this is just an opinion, is those are, when we talked about the edges, right? Like the people who have the vaccine response that's super intense, and there's a severe reaction to this seemingly innocuous stimulus. The same story with the wild type virus. There are going to be some healthy people that have an immune storm around getting exposed to the coronavirus, just like they are to the flu virus, just like they are to any number of microbes. I would say it has something to do with their individual susceptibility that has a lot of factors to do with it. I wouldn't per se call it their compromised terrain, although I think in a lot of the cases, there's probably a very dysregulated immune system status that leads to this severe extreme response, and you have this tragic situation where a young, relatively vital, healthy person ends up succumbing to a microbe, whether it be coronavirus or any other. And that indeed has always happened and will continue to, but I would argue because this COVID-19 virus is a little more aggressive than your run-of-the-mill viruses, that there's a little more of that happening. But that's an exquisitely rare phenomenon, and that we are made to believe that it is very common because it further perpetuates a culture of, and I won't even go into the emotional words that I'll bring up there, but that's my suspicion and hypothesis, that those are extraordinarily rare cases. I do have a colleague that works in an ER, and I've kind of chatted about, hey, what are your patient populations of these people getting hospitalized for COVID? And the feedback was, 98% are that first category I mentioned of, many drug therapy, many chronic disease diagnoses, very, very compromised, elements through and through of the train.
I have a connected question.
Yeah, sure.
You said that someone who has a compromised immune system, say they have autoimmune or allergies, they may not be a candidate for the vaccine because of the immune response.
Hyperreactive
Right.
immune system, yes.
So how does that relate to the example of the 400-pound person that you would recommend they get the vaccine? Are you saying that they would
It's a trade-off,
might
right?
be better off with the vaccine than the actual infection?
Yeah, because we got to remember too, right, that them getting the infection can precipitate all the same actions as the vaccine will, except you have this virus that has this really strong capacity to quickly replicate, and their immune system is shot or basically incapable of really meaningfully, mounting a good, intelligent response against it.
So then why wouldn't you recommend the same for someone with seasonal allergies or autoimmune? Just trying to understand that.
Because if their general, more fundamental vitality is a lot higher, then I would have less concern about them getting the wild type virus in terms of their immune system's capacity to clear it. And if they're not going to get exposed and other things are going to make them not susceptible to it, why guarantee that we're going to put a shot in your arm and elicit a really robust immune response?
Okay.
So it's kind of like, how the cookie crumbles is like, in any sort of infectious disease situation, we're all going to get probably exposed to COVID-19. We're not all going to get it, and we're all going to get exposed at the same time. And it's just like, it's a philosophy thing, right? Of like, if you're knowingly putting something in your body that has the potential to do harm, like, do you want to make that choice, or do you feel like you deserve to have the choice? And then if you know certain predispositions about yourself, like I have autoimmune diagnosis, there's a higher propensity here to have a really, haywire reaction precipitated because my body's already proven that it has the capacity to do that. Then that creates a little more index of concern for me. I don't blanketly tell people with autoimmune diseases don't get vaccinated. I have an individual discussion with them about the forces weighing in their life and their health that might, have a consideration of what the best choice for them is. Yeah, good clarifying question. Yeah, any other pieces about this? Go ahead, Brenda.
What's the best way or ways to eradicate the stomach bug?
We'll get to that. We're going to get to talking about some of the treatments, so I'll catch you on that one. Okay, great. So again, in summary, it is, in regards to the vaccines, it's very much an individual discussion and a personal choice. And I will never, ever have a patient come in and tell them what I think they should do. I will first start by having a discussion with them about how they feel about something, what's going on in their life, what's the context. Right? My job is to listen mostly. And when advice is asked, to collaborate in a conversation to arrive at a place where a person feels like they have more knowledge to make the best choice for themselves. This is really important to hear that at the end of all of this, that my most, heartbreaking ethical concern is the practice of wielding guilt, shame, and coercion into telling people what they should do with their bodies when it's our choice. We all get to choose. And anything I ever talk about, no matter what health related with the patient, it's always couched in the context of a choice. It's like, how do you raise your child? Well, you can tell them what they have to do. How does that work out? Usually not great. If you give them a choice, well, you can have eggs or you can sit at the table for the next hour. You get to choose. It's a lot better way to frame it, and you're right, because we always have a choice. But it's really unfortunate when a health conversation is not presented as a choice. So I really want to argue that point and make sure that that's really clear to people that that's on a fundamental level one of my most deep-seated values and truths. So in terms of going forward, I want to jump beyond what our immune system is, how pathogens make infection, all that. And I want to talk about the way that we can influence our terrain. So what is it that, what are the main forces that are modifiable, that are choices for us, that influence the robustness of our immune system, the kind of richness of our soil to either host infection or be hostile to infection. And there's some big ones to go over. I think one of the most simple ones is hydration, right? If most microbes get into our system by landing on our mucous membranes, then if our mucous membranes are really slippery, it's going to be much harder for them to land. It turns out that the more dehydrated are, the more sticky our mucous membranes are, and therefore the easier it is for the pathogen to just lock on there and start reproducing and growing. So that's one thing that's really important is be hydrated. You know, work on that as a practice in your life. Most people are not hydrated, partly because they drink very dehydrating substances like soda and alcohol and coffee, and also because they don't drink enough water. Half your body weight in ounces a day is a baseline that I, encourage people to shoot for. And so that's a really easy one. One of the proactive preventive strategies with an upper airway infectious disease is to do like saltwater gargles, or to do mists like humidifiers that will furthermore make those membranes moistened through an external means. Obviously my favorite is to just internally hydrate ourselves. That's a really important one. Sleep is also so critical. Our immune system, really every tissue in our body really tremendously relies on sleep as a means to regenerate and restore function. It's, rest literally is one of the most important parts of healing. Even whether it's a chronic disease, acute disease, one of the big issues that comes up is our mind and our actions are not giving ourselves permission to get appropriate rest. And that doesn't just mean sleep. That also means downtime for our nervous system to not be in a do and perform mode. And so, if people have sleep issues, dysregulated sleep pattern, if they have sleep apnea, if they are restless and their minds are wired so they wake up and get interrupted, if they just don't value sleep and don't allocate the time their body needs to be fully rested, and this goes on chronically, then we're just shortchanging all of the systems in our body more and more and more. And so that's a huge, huge proactive way to work on the terrain side of infectious disease. And I think what dovetails nicely with that principle is this big word we call stress, which is something, again, that's very important to how we survive in this world, to have a stress response, to be able to mount a fight or flight response in the appropriate setting, like when our very livelihood is threatened by a predator or a dangerous situation. But what we have in our, again, mostly first world society is chronic stress and chronic fight or flight. And of the many problematic physiological things that chronic fight or flight brings on, one of the biggest issues is immune dysregulation and immune suppression. So chronic stress is arguably one of the biggest compromising forces to our terrain that we have. And one of the examples that most people can relate to is everyone's probably had a test in school that they were really hustling and studying for, or a deadline they were trying to make in their job. And they have this pattern where, all right, I'm going to push through this thing, I got to make it through, all the stress response firing off, probably not sleeping enough. And then at the end of it, when you're like, okay, finally I can relax and I made it through, then you get sick. And what's actually happening there physiologically is you've been suppressing your immune system to that whole buildup of getting you to the test, getting the assignment done. And then all of that time, this infectious stuff has been seeding in your body and starting to grow and build. And then when you finish it, you're resting, and so your immune system wakes up and it's like, holy heck, we got infection going on. We got to take care of this. And so then the symptoms of illness come, right? Does pretty much everyone relate to that? Yeah. So that's just such a big, piece of our immune system's vulnerability status and terrain status. And if I could say, just in clinical practice, the thing that I would spend the most time illuminating with people, it's how our minds relate to our world in all the relationships and environmental settings and patterns of belief and thought, because it's our mind that's priming the stress response, right? So when we're talking about a physical process like infection, we have to remember that our mind has this really powerful role to play in how we engage all of these other forces in our life, because it's the mind that tells the stress response through the nervous system to kick on. And beliefs are powerful. I was reading, I love medical history, and so I like to read the founders of my profession, like, what they had to say. And one of the guys, I really appreciated, he was really talking about the power of belief in actually infectious disease, that if you believe your body is capable of taking care of and addressing the affront or the insult, that's a really critical tool in the healing of the infection. And I do think there's something to that, because our minds, again, are just so powerful. We call it, in conventional medicine, the placebo effect. And it's so powerful, in fact, that any drug that's ever made, you have to compare it to the healing power of your mind. And that's why so few medicines ever get developed, even though we pour billions of dollars into it, is because our mind is just way more powerful to influence health outcomes, right? Us thinking that we're taking a pill that's going to help us improves symptoms on average 30 to 40%. And there's literally nothing in that pill physiologically active. And so you have to beat that with the drug to get it to be something that we can put out there. So, little aside for the healing power and destructive power of the mind, right? Say, on the converse side, you're being told, I'm going to give you this poison pill that's going to make you feel terrible, then you could get the placebo and feel terrible. And that would be probably the same effect. So when we're in a really stuck headspace and we're, kind of gripped with fear and anger and, self-criticism, etc., that's a really destructive force in our body too, which I think is one of the greatest contradictions of the whole way that we've handled the pandemic, right? Is that all of the emotional collateral implications of just using the microbial theory and, taking away physical touch and taking away this fundamental need we have to be social and to engage with each other in an energetically, emotionally connected way is really, really destructive to our mental, emotional state of well-being, which goes down the line on the terrain side to make us way more susceptible to the microbes that we're always being exposed to, no matter what. And so that really bothers me as kind of a miss in terms of understanding how complex we are in the bigger picture of our nature. So those are a couple of things that are a very big deal in terms of terrain. I also want to talk about circulation, big one, circulation. So how do we get the immune system where it needs to go? How do we keep tissues supplied with good, healthy oxygen and nutrients? How do we take out the trash from the tissues where they have metabolic waste products? Well, we need to move it through the bloodstream and through the lymphatic system. So if we do not have an intelligent, vigorous flow to our circulatory system, then we're going to have compromise to both the removal of waste debris as well as the bringing of immune cells and nutrients to the tissue to keep them robust, vital, and healthy. And so we have this heart muscle that pumps, right? That's its main job, is to distribute, circulate. So if you have a compromised heart muscle that doesn't do that so well, then we're going to have issues, right, with circulation. And if you're obese, that's actually a big thing that kind of inhibits circulation in a big way. It's harder for the heart to pump through all those new little blood vessels that are being put in the tissues. But there's a lot of other things that compromise circulation. The biggest thing that compromises it is being sedentary, is our modern, again, way of living as human beings. It's 8 hours a day in front of the TV and the other hours in front of a computer screen or behind the wheel of a car. I mean, our ancestors were cruising around like 10 hours a day, constantly in motion. That muscular contraction is pumping our vessels, is pumping our lymphatics to move all of these vital fluids around. And so most people exercise very minimally, and they certainly don't have this dynamic, active lifestyle. So that puts the terrain in a major compromised position. So exercise, again, is so fundamental. People who exercise get acute illness way less. It's very clear evidence. that's there, and the science is very robust about that. The way that I like to work on circulation that's a little bit different of a therapeutic tool is called contrast hydrotherapy, so water therapy. And the principle of contrast hydrotherapy is that when you alternate hot and cold to the skin surface, you essentially cause this squeezing of the blood vessels and lymphatic tissue, and in doing so you move the blood and lymph and you enhance that exchange. And we actually have good research about white blood cell counts with contrast hydrotherapy. It's really amazing how much it raises white blood cells in the tissue. And so what I recommend to people in a very simple way is end your showers on a cold rinse. Start at your periphery, start at your feet, go up to your hips, start at your arms, go up to your shoulders, get the front and back inside of your torso, and end by rinsing your head, and take about a minute to do that. The more the contrasting temperature, the more therapeutic. If you want to be super hardcore, like many people have heard of this guy Wim Hof, he's a goofy character from Finland, you just take cold showers, just ice cold showers, which that's a rare person who's up for that, but it's even more vigorous for the immune system. So this idea of contrast is so helpful. You can dry skin brush with a rough horsehair brush, that can be good too. But on a real basic level, right, just moving our bodies and how the mechanical pumping of our muscles contracting is keeping our circulation going. So that's a big piece. And then I've been going through a few. Are there any questions around any of these areas that people want to kind of elaborate on? Okay. Yeah, go for it.
What do you think about exercising while you're sick?
I tend to think gentle exercise can be nice, but really vigorous exercise can be overstimulating and depleting to the other things your body's trying to allocate resources to.
Okay.
Yeah, go for it.
So you mentioned obesity. What about how nutrition? Do you have any recommendations on nutrition?
Yeah, I was just going to get into that. It just seemed like kind of a bigger topic, and I didn't want to just lurch into it before. Like, hey, we just covered a few things. And questions? I'm right there with you.
I have a question.
Yeah.
Is that hydrotherapy? Have you heard of hot and cold foot baths?
Yes.
I
Yeah.
grew up with those when I was a kid in Canada.
Yeah. Cool. Same principle. I actually treat, and we're going to get into some individual hydrotherapy treatments with actual illnesses. But I've treated so many lower extremity conditions with contrast foot baths. I've treated so many pelvic conditions with contrast hip baths. So many respiratory conditions with contrast work with the chest.
Where you go
throat.
back and forth. Hot
Yeah, it's all about contrast. Yeah, it's an amazing tool. I mean, kiddos with warming socks, any type of illness for kids, you put wet socks on their feet, cold wet socks, and then wring them out, but then put them on their feet and then cover it with a thicker wool sock or hiking sock and put them to bed. It really knocks them out pretty good. But it's a magical, I mean.
My parents must have talked to you.
Oh, yeah.
That's us too.
Yeah, or their naturopath taught them, or some other thing, yeah. So, really great tool. That's a good one to know for kiddos. Yeah, so hydrotherapy, awesome. I love it. The ancestors of naturopathic medicine, the founding practitioners of this philosophy of health, hydrotherapy was like their main tool. Back when the conventional medical practices were bloodletting and surgery and giving people mercury, like you went to the doctor to die basically. And so you would have the naturopaths out there doing hydrotherapy and helping people heal from super serious stuff because we didn't have all the knowledge of these other cool modalities we do now. But yeah. So nutrition is a really big part of this. So remember how we're talking about terrain and the soil being having a lot of debris in it to make there be a lot of food for the bugs, right? The bugs need food to thrive and grow. They can't just reproduce with nothing, they need materials. So, in my opinion, one of the biggest causes, not only of weakening our immune system, which I'll talk about, but of feeding infection is the debris that accumulates in our bodies as a consequence, in large part, of intake of toxins. So our standard American diet is nothing like our ancestral diet. It is full of literally, I think it's like 150 pounds a year, the average American eats in refined sugar, and that's just sugar. That's not all the bread and crackers and pastas and French fries and like all, that's just sugar that we eat a year on average. And then you just have all these refined starches, which again, that's exactly what viruses and bacteria like to eat. That is going to make them grow and thrive like crazy. So when we're depositing all this into our bloodstream, into our tissues, we're essentially putting this, this basically kindling down and just waiting for the spark and waiting for the match. The microbe is the match, right? And so we just, we need to get rid of that kindling. And really a big part of that is what we choose to put in our body, And again, I mean, there's lots of open forums I've done talking about nutrition, but just really basically eating a mostly plant-based diet of whole foods where you look at the food you're eating and you say, I know what plant that came from. Like if it's in a box, if it has a label that you have to read, that's not real food, and it's going to accumulate toxicity in your body. And unfortunately, our food industry, because it's all about the money, is really keen on, well, what are humans hardwired to crave? Well, it turns out that our ancestral diet, because there was famine all the time, we were really like keyed into when the getting's good, let's like really get this, and it's sugar, fat, and salt. And so we've basically developed a system by which we've created foods that are just tailored to all of our most powerful habituation pathways to activate those centers in our brain and those cycles of craving and reward to key into that. And it's very like sadistic. I mean, that's again what we've done, and it's widely available to us always. And so I feel really a lot of compassion for the difficulty of changing this paradigm and of making change for people. Pizza's my favorite food, right? I would eat it every day if it didn't make me feel awful. But yeah, so it's an issue. It's a huge issue, and it's probably, again, if we had gotten this pandemic going and we said, okay, here's what the one piece of guidance is. Stop eating refined starches and sugar, and let's see what the results are. Let's see how many people die. Well, we would just, it would probably be like, not happening, and then maybe probably, millions less people would die of other caused diseases that were a result of those choices, right? So it's interesting that we chose to put all of our eggs in this one basket that we talked about earlier, that there's so many other baskets we could have, worked with. So, so we're creating this debris, but also on the flip side with nutrition, what we also do is we dysregulate, we're talking someone said GI overgrowth and leaky gut and microbiome. Remember how I said the immune system gains all of its intelligence and way that it efficiently responds to pathogens based on that interface with the bugs in our gut mostly. And so, and I also said that the bugs in our gut and on our skin and our mucous membranes, they're actually protecting us against the other bugs. So when they're around, they're also saying, hey, there's no room for you. You can't land and, kind of get active because we have this nice thing going on. You have nice turf of lawn. And so there's like two sides to that, right? The bugs actually are protecting us, plus the bugs are talking to our immune system and teaching it how to be intelligent. So when you're eating all these awful foods, or when stress is shutting down your digestive process, which is also what stress does, then it just wreaks havoc on our immune system's function and on the bugs that live in our gut that are so critical to that. So that's another really, really crucial principle and understanding of just how much we can influence that part of the model of infectious disease and immune health and terrain. So then an interesting kind of other side of the coin that we don't tend to think about a lot but is so crucial is our body's actually always making toxins. Our immune system makes toxins to kill bugs. right? So it's not that toxins are bad. Our liver, one of its main roles is to detoxify things, dead cells, red blood cells that have come to the end of their life, byproducts of metabolism. These are all like, things like toxins that our own body makes, and it's normal and healthy. So when we're dealing with toxic burden in our body, we also have to talk about, well, how well is our body doing getting rid of these toxins? Because we're making them, we're consuming them maybe from our food, how are we getting rid of them? And it turns out that a lot of people aren't doing a great job of that, right? Circulation is one of the big ones that is part of that elimination process. We got to get those toxins to the elimination organs. But we also got to think about our lungs, we got to think about our kidneys, our colon, our liver, our skin. These are elimination organs in our body, and a lot of people have a really compromised, sluggish colon. A lot of people have really encumbered livers. A lot of people don't drink enough water and have kidneys that aren't filtering at an adequate rate. Most people don't breathe into their diaphragm, so they're only using about 1/3 of their lung excursion to exchange gases, which is another great way to remove toxins. So when our elimination organs are compromised, then we're going to retain more toxic burden and debris. And so that's another really important piece of work to be attentive to when we are dealing with, again, the terrain and what's making the terrain hospitable or susceptible to microbes. Yeah, what questions on that topic? Anybody want to elaborate there more? So I wanted to make sure I devote a bit of our remaining time to naturopathic approaches to local infections in the body, and I won't talk about, well, what causes this and that, and what are the symptoms. I mean, we've all been sick, so I'm just going to jump into, hey, here's some things for upper respiratory, and here's some things for your urinary tract, and here's some things for earaches. But I'm going to do some platitudes too that are just generally true for all infectious disease, that are very good standby naturopathic tools. So I'm going to transition gears there if everyone's good with that. And I will say that, I can count on, now after 8 years, it's probably on 2 hands the amount of times I've prescribed antibiotics or refer someone to higher level of care. But the problem with those conventional tools is that they have side effects. They have other problems they create. So when we for example, treat a bacterial illness, whether it's a gut bug or a respiratory bug with an antibiotic, we wipe out a lot of the forces that, from a microbiome standpoint, that is making our immune system intelligent and robust. And that's a real big problem. When we give people steroids to suppress the immune system's inflammation, we may actually kind of put the damper on the fire, but we may prolong and turn it into a more chronic illness, or suppress the process and drive it deeper into the body, into a more vulnerable, vital organ system. So the classic example is eczema, giving people steroids, pushing that into the expression of asthma. But often we'll give steroids for infectious disease too. Same principles apply. So one of the things that's really great about how to help the body in clearing infectious disease more generally is the use of fever. So I want to do a little caveat there because, we have this misconception in our culture that fevers are so bad and such a problem, and we got to take aspirin or Tylenol, to don't get a fever. And we're giving these to our kids, and it's that's probably one of the worst things we can do when we have an acute infection. Because what the fever is doing is it's by increasing the basal temperature of our body, we're revving up our enzyme pathways, we're making our immune system more vigorous, we're making some of the immune signaling molecules more perceptive, and we're helping the body more rapidly clear infection. The only time that it becomes a problem is when your fever gets high to the point where it actually is like boiling up your tissue. But that level for most people is like 106, 107. I don't know, has anybody had a fever that high in here before?
Oh, but they call you and tell you if you go up to 104, call us and you need to go to urgent care.
Sure.
So what would happen if I stayed home at 104?
Well, I'd want to manage the fever with you and use like hydrotherapy, like cooling compresses, tepid baths, fasting, which I'll talk about in a second, to kind of manage the fever, packing compresses on you. That great way to kind of just modulate the temperature down a little bit if we need to. But the other situation where fevers can be a bit of a problem is when they're rapidly changing in temperature. So if you go from 96 to 101 degrees in 10 minutes, it's very possible to precipitate a seizure because the body doesn't like to adjust that fast. So a good 101 fever, like that's perfect, you know, creeping up there over a few hours, like great. But going there in 10 minutes, 5-degree swing, that can be an issue. A 10-degree swing, even more. And so that's another scenario where, again, we don't usually see this come up when the immune system is intelligent and balanced. We mostly see it come up, in my experience, when people are suppressing fevers with aspirin and Tylenols and they wear off and then the fever shoots up. And if you weren't suppressing them in the first place, we wouldn't deal with this. And that's where the seizures can often happen. So, so that's something to know, that fevers are our best friend in infectious disease, and a healthy, good, robust fever means, okay, our immune system's activating and doing its job. Where we get worried is like an elderly their vitality is so low that they can't mount fevers and they can't mount an immune response and they succumb to infection. So a little aside about fevers, but a very important part of the treatment is just good old nature and how our body's intelligent. The other thing that I really want to diversely, encourage is fasting. And fasting is to go without consuming food. There's a little different ways to fast. You can fast, the most extreme way is on just water or herbal tea, but you can also fast on vegetable broths. You can fast on bone broth, just like liquids that don't even have fiber in them. And what the advantage here is especially with like bone broths and veggie broths, you're still getting electrolytes in your body, which your body likes. You're still getting some salt. These things are helpful to maintain homeostasis. But all of the energy that we use, which is half of our output, that goes into digestion, you are freeing up and liberating that energy basically to reallocate much of it to your immune system. So if you can have the discipline to fast at the onset of a cold, it's very likely that that cold is not going to progress. If you really, any form of infectious disease, or it's going to get finished a lot quicker, right? Why would we do therapies in the first place? It's to say, okay, your body has a 99.9% chance of resolving this, otherwise that 0.1% you're going to die. But we want to help it happen quicker because it's no fun to be sick. In the first place, we don't want to get sick at all, right? And that's this whole main part of our lecture about the preventive model of the terrain, right? If you're not susceptible, those bugs are not going to establish shop and grow and build. But once it gets going, our goal is like, we don't want to feel this way any longer than we have to. Is there ways to more rapidly clear this? And so fasting is the #1 most simple method. And our body, in its wisdom, knows how to tell us this. I mean, has anyone ever not experienced loss of appetite in the context of acute illness? Right? It's what our bodies do. And then what I've been told by our conventional doctors, make sure you eat. It's really important to eat. And it's like, no, that's actually the thing that's going to bog things down. Not only because we don't free up that energy for our immune system, but because often we're going to eat things that feed the infection, like dairy, very mucus forming and kind of congestive, slows down our immune system. Sugar knocks out our immune system, feeds the bugs. Refined starches, right? All of those things. So to say, go have chicken noodle soup and crackers with Sprite. I mean, it's like, no, don't do that. I mean, that's not helping you get better fast. It might be comforting to you. I don't know. So that's something that just everyone can know, and just be trusting of, even with a kid, you can fast a kid. You don't have to, you can give them little bits of, soup, but they don't need to eat. And so that's a great tool to utilize. I also talked about hydrotherapy. So I mentioned you can do contrast work anywhere. You can do the warming socks, you can do a warming t-shirt, you can do a warming throat compress. These are all really valid ways, depending on where the infection is localized, to get blood flow, and therefore immune cells to the tissue being affected. Really great. I recommend hydrotherapy to everybody I treat acutely that calls in or comes in for an acute illness. Another thing that I use with most people with acute illness is homeopathy, and that's a natural medicine tool that's incredibly powerful. It works really great, especially on children, because the medicine is tasty and easy to give a child, even that's an infant that's 2 weeks old. It's little tiny granules of sugar that have been medicated pellets. And what it does is it actually goes to the level of the signaling of the immune system to, remember how I talked about our immune system has to identify the infection? Well, what I would say that homeopathic does is it helps the immune system better identify the infection and kind of rush it to the scene. And it's non-invasive, it's not going to have side effects, and it's a very powerful tool that will rapidly shorten the duration of an acute illness in many cases. The kind of caveat to that, or the condition to that, is that you need to pick the right remedy. So if you have 100 people with the same virus, or let's say the same bacteria infecting them, all 100 people will be given the same antibiotic in conventional medicine, right? There's not much of an art to that, like not much of a skill to that. It's like, oh, you got a bacterial infection, let's give you all this antibiotic. Well, in homeopathy, you have to be very precise and individualized about the unique remedy that's going to respond uniquely to how that person carries the bacteria and manifests it in the body. So all 100 people who have the bacterial infection might get 100 different remedies. So it makes it a lot more challenging for the practitioner, and it's why we can't all just say, oh great, like I don't have to take antibiotics, I'll take homeopathics. I'll go take the one off the shelf that says cough. No, it doesn't work that way. There's a much more complex, skilled process that takes lots of training. I would just call myself a novice in it still, even though I've dedicated hundreds and hundreds of hours to prescribing, learning, and even teaching classes on it. But nevertheless, within the course of like a 6-week acute class, I have, patients who have taken that class and they get out their kits and they only call me in situations where they're not able to kind of work through it, and a lot of times they'll report those homeopathics dramatically reduce the length of acute illnesses. So great tool, but I'm not going to go into specifics because we can't, since it's an individual conversation. So any questions so far? Yeah?
I just wanted to be able to clarify the fasting. You have talked about duration, and although I feel like I'm understanding, because I've heard this before, you also said children can fast too, they don't need to eat, and I know that's not what you directly meant, but I thought maybe if you could just talk about that.
Children don't, you don't want to fast children like for days at a time, or even probably like more than 12 hours, because they are growing, and so you don't want to deprive a being that is needing an excess of calories to keep building. But short term, for 12 hours, 24 hours, absolutely safe. Just not indefinitely. And I wouldn't recommend adult fast indefinitely with acute illness. The whole point is when you start fasting, you're going to clear it much more quickly, and your appetite will come back, and as you're feeling better, you're going to start eating more. So it's there's gradations to this. But at the onset, if you can discipline yourself to say, okay, I'm going to let my immune system have more of the pie here to do the work, and I'm not going to bog things down, then it's really helpful.
There's a little side kind of funny benefit to that. I'm a teacher.
Yeah.
And if parents found this out and children were pretending to be sick, they didn't want to go to school, they found out they had to fast.
Yeah. That's a really good point, right? Because there's that, in medicine we term that malingering. But kids kids definitely when they're pulling the strings in certain improper boundary relationships with parenting can take advantage of that one.
Do you recommend fasting outside of sickness?
All the time. Yeah, I actually just got done doing a group fast with 35 people on Zoom. I do it twice a year in the spring and fall. It's one of my favorite tools. One of the areas I'm passionate about, detoxification medicine. And yeah, the research about fasting in terms of its health benefits are like, there's like no such thing that ever existed more powerful than fasting in terms of its ability to reverse disease and extend longevity. I mean, it's crazy, yet our society is so fearful and so misunderstanding of what it is and how implicitly it's built into our evolution, that we came from a hunter-gatherer ancestry with feast and famine, and that that's what we're designed for, and there's all these important outcomes that it brings with it that are really good. So yeah, I totally use it all the time.
And what would be like a frequency and duration of that?
Well, it depends on the type of fast, the individual's health situation. Like, myself, I do it twice a year, but like, I don't want to really lose any more weight than I have around, and I think that spring and fall for the average adult is a great time to do it, and usually for like a week is a really like solid, fast. And it can be modified. Like I do most of mine with juice, vegetable juice, and like some smoothies to keep your colon activated, versus water fasting, which is actually much more demanding and requires like you kind of step out of your daily commitments in life to do.
I tried that once, it was insane.
Yeah, you have to really build your way into it thoughtfully. So yeah, great tool for this training conversation.
And does it tie into seasonal eating to fast from certain foods too?
Yeah, I would say so for sure. Yeah, I can get into that when we're getting close to getting to that topic. Yeah, there's certain things to emphasize at different times, or fast or abstain from. Yeah, go ahead.
I want to make sure I heard this correctly. If Western doctors have diagnosed you with a degenerative neuromuscular disease, is fasting still advisable?
It can be, yeah. It can be a really helpful tool. Yeah, it just depends on the individual circumstance. It's not a universal, right, because it's an individual conversation with each person. But I use fasting on most any person, except if they're pregnant and breastfeeding or they're a child. So in the right context, yeah. So if you, yeah.
So if they've never done it before though, would you say they would do it for a week, or would they?
I would not recommend someone fast without guidance who's never done it, just because there's a lot to it to have the best experience with it. Yeah. So a few other things that I want to get to. I'm going to talk about a few specifics. So I'll just mention some nutrients that are really helpful to the immune system. One of the questions is vitamin D. Vitamin D is one of the most important compounds for our immune system. It has all sorts of thousands and thousands of medical literature reference of how vitamin D interacts to make our immune system more vigorous and reduce our rates of infection, severity of infections. There's a very strong linkage. Vitamin D is kind of like a hormone in our body, and we make it only by being in the sun. We don't get it from our food. It's kind of a unique vitamin in that way. And so again, our ancestors didn't wear many clothes, and they didn't, they're always outside. So it turned out they made a lot more vitamin D than we do being inside and wearing clothes. And so most everybody doesn't make enough vitamin D just on their own because of those life forces, and consequently those low levels make our immune systems more susceptible. So I tend to recommend people supplement proactively a little bit of extra vitamin D, like for adults around 4,000 units a day, fat soluble, so with meals, as a really robust protection for our immune systems. And sometimes I'll have them really bump that up during acute illnesses to 10 or even 20,000 units a day. But it's probably, if you were to take one supplement everyone should take, that would be it, I think. And it has all these other great benefits for anti-cancer, mood. Like I said, it acts like a hormone. So hormones are signaling molecules in many purposes. Yeah.
Do you have to take it with vitamin K? And then does it matter what type of vitamin D? Like, can you just get anything?
Yeah, it's vitamin D3. I like to take it in a carrier, like an oil carrier, because it's fat soluble. So the one I prescribe is a liquid drop that's emulsified in olive oil. You do not have to take it with vitamin K, in my opinion. I tell people to take it with food, and if you're eating substantive amounts of vegetables are just loaded with vitamin K. So I don't kind of go into that theory with that, because to me it's like, we're supposed to take it with food, and we're trying to eat whole foods, then we're taking a heck of a lot of K in with the vitamin D. So I don't like ascribe to that like some people are really into that. And I find people get their levels up great with, without K. Yeah, in the back.
Does it matter if you take the vitamin D in the evening or in the morning, or does it not matter?
No, I just say daily. Like sometimes physicians with people with low vitamin D will prescribe vitamin D2, 150,000 unit dose of vitamin D2 a week, which is so silly to me. Number one, because it's just not copying nature is the big thing. But number two, vitamin D2 is not in nature. Our body doesn't even make it. It has to interconvert it. And why would you get, make 50,000 units a day of D and then make none for the next 6 days? Like, no, make it every day. So, yeah, I think that just doing it daily is best.
I've heard that if you spend time outside that you shouldn't take a shower within the next 24 hours because you'll wash off the vitamin D off of your skin.
No, that's not really true. Maybe there's like a kernel of truth to that, but you're synthesizing vitamin D in your melanocytes. Okay. And when you wash your body, you tend to be washing off dead cells, not live cells. So that might happen a little bit, but very minimally.
Okay.
Do we absorb any D through our retina at all?
No, you actually make D in your cells. So there are not melanocytes in your eyes. What you do there, though, is you have your pineal gland behind your retina. And your pineal gland has all sorts of things going on in terms of how it communicates with your body in many important ways. So the sunlight from that happens of the retina stimulation of the pineal gland is hugely important to our health and well-being. And by the way, like I prefer people to get out in the sun and make vitamin D. I'm not saying that, don't get sun and, just take vitamin D. It's the best way. And some people don't absorb vitamin D very well. And that's a whole other conversation. But, yeah.
Can you recommend a good vitamin for eye health?
I can later when we're talking about supplements.
Okay.
Yeah. Yeah, okay. So vitamin D, right, is a good one. And we'll just stay with the vitamins. So vitamin A has some really good immune properties. I don't tend to recommend it being supplemented, just really good. And you eat your veggies and fruits, you get a lot of vitamin A. Vitamin C is one that I tend to recommend more kind of proactively in terms of a supplement with immune prevention and immune treatment. But you also get it from citrus. So the big place we get C out of is citrus. So lemon, lime, grapefruit. I don't recommend oranges as much as the sugar content, but it is really bactericidal, virucidal, very strong immune enhancing properties. And so 1 to 3 grams a day of ascorbate, which is like a buffered C versus ascorbic acid, as a prophylactic, and it's water soluble. Doing it in a powder is best because you can kind of just put it in your water and be getting a little bit through the day. If water soluble, just gets moved out of your body more quickly. And if you're acutely ill, you can just really ramp that up, basically to the point where you don't absorb it, which means your bowels get loose. And so for some people, that's like around 10 grams a day. But a really good thing, and certainly viral and bacterial, fights both. I also really like the compound N-Acetyl Cysteine. I think I'm going to stop at vitamins there, because that's like but N-Acetyl Cysteine is an amino acid complex, and it's really good for the liver for detox purposes, but it also, it cleaves like mucus bonds on the mucous membrane surfaces. So when you're like dealing with infection and like in the mucous membranes, like the chest or the throat, it'll actually like break those surface bonds and knock out the beginnings or the end of infection. So 1,200 milligrams a couple times a day is great for that one. I use it a lot. I also really like, from a mineral standpoint, zinc. Zinc just has, again, a bunch of immune stimulating properties and really good evidence with reduction of severity and duration of viral and bacterial infections. Mostly in the upper respiratory, we're not talking about like gut and urinary. So this is more upper respiratory is where the focus would be. Same thing with the NAC, I guess, too. So those are a few. Then there's the whole world of herbs. Like you got echinacea, you got golden seal, you got licorice, you got osha, you got bloodroot, to name a few. I mean, there's many, many more, but those are just some of my favorite herbs. The cool thing about herbs is, unlike in conventional medicine with drugs, you got just things to really take on bacteria. The herbs are great at taking on bacteria and viruses, and they don't mess with your gut microbiome. So they can be really powerful tools. I use herbs in the treatment of urinary tract infections. I like barberry for that. I use formulas of herbs to treat upper respiratory infections descending into the lung tree. That can be very powerful. I've treated lots of, bronchitis and pneumonia with that. Kind of drive things up and out. And so, yeah, I mean, botanical medicine is a great tool alongside homeopathy, and really regularly I use it. And, I can get into more like location-specific things, but I feel like I've already held you for a little longer, so I'm going to just kind of pause it there and see if there's any kind of lingering questions about the topic that we haven't covered today.
Are you going to go into cardio versus weightlifting?
Oh yeah, no, I'm going to get to this.
Oh, okay.
It's just more about like our like kind of broader topic to touch on that I just ran through some things. So if there's additional questions, I'm happy to field them pertaining to this.
One more question, sorry.
Yeah.
So would you say that the medical establishment would seek to discredit some of this stuff that you're talking about, like the herbs and stuff like that?
Oh, well, what I would say that they might more likely do is say, well, show me where the research is that proves what you're saying. And I would say, well, there is some research, and I can go show you that, and, but then I would say in the same breath, there's a fundamental issue here. There's two main issues. The first issue is that how our scientific system works is that, same thing with our healthcare system, is it's about profit. It's about basically making money for corporations. And so to do research, which is what all conventional doctors will say, well, I want to see the research. You need a lot of money to do that research. And if you can't patent echinacea, if you can't patent golden seal, then there's no incentive to do that really robust research. So unfortunately, we just don't have the research because we don't have a financial incentive of someone profiting from doing the research. So that's number one. Number two is when I prescribe these types of medicines, I prescribe them based on individual pictures. And the Western scientific method is what's called the gold standard is double-blind placebo-controlled trials. So what that means is in order to have it be a valid study, everyone has to be the same. So the variables are all the same. Well, what are we as human beings but like the epitome of individual? I mean, everything about us is unique to us. So when I treat people, no matter what I'm treating them for, it's a very individual conversation of the unique forces affecting their health that goes into the selection of the medicines they prescribed. So in terms of these things, I might give one person echinacea and they have, real strong benefit, and the next person doesn't. And that might go on genetic factors, many other factors. And so when you're doing natural medicine research, I think the best model for that is what's called systems-based, where you individually treat a person with naturopathic care versus conventional care for the same condition, and then you look at the outcomes.
Right. It's just frustrating because the conventional doctors will say something totally separate than you guys. So like I can look up like stuff on vitamin C and it says it really hasn't proven to be beneficial in any way. So I quit buying it, and then you say it is beneficial.
Yeah,
And
yeah.
So it's like,
Well, that's from my clinical experience primarily.
yeah.
Is why I would recommend that.
And conventional have been doing C and D for a long time. That's true.
Yeah. So
40 years ago, yeah, they would have said, nah, it doesn't do anything. But for the last 10 to 20, they've been using it for sure.
I might challenge your provider to say, do you have evidence?
There's stuff online.
Yeah,
It's
yeah,
online,
yeah.
you know.
Well, again, people can say whatever they want to say online. That's the beauty of the internet. It's a free speech forum. Kind of like this is a free speech forum for me to be giving you all my opinion about life. I mean, it is what it is. Like I'm not here to convince anybody of anything. Just like, have a conversation that hopefully you feel is beneficial to you. So yeah. Any other questions about the topic before I launch into some of these specifics?
I had a question about the microbiome with using probiotics
Okay.
in terms of repopulating.
Okay, and I will get to that when I go through this topic. Yeah. Cool. All right. Well, for this immune topic, thank you all. I've been looking forward to chatting about this. I wanted to do this a few months ago, like in the heat of the pandemic, but then they canceled my talk here, so I couldn't. Although I think everyone would have been quite uncomfortable in this room when the cases were surging in our population. I actually probably would have been really cool with it. So I'm glad that this space got a lot smaller than the last time I lectured here. So anyways, let me get into these questions. I feel like I kind of covered vitamin D, right? Was that sufficient for the question that was out there? Okay. mRNA in the immune system, was the question about how the mRNA works?
She left.
Oh, she left. I'm going to skip it. That's the other thing is I like to kind of probe to see, did that person hang around? I'm not going to go over some of their questions if they're not here. So the GI system we're talking about, give me a sense for bacterial overgrowth, leaky gut. Was that person here? She took off too. Okay, so then I'm just going to answer your question about, you were asking inoculation, probiotics, ferments, the value of them, right?
Yeah, and all food versus supplement.
Yeah, totally. Great question. I love the foods, right? Because my style of being a naturopathic practitioner is I want to engage from nature. So as much as we can do through our lifestyle and food as medicine, I prefer that. Plus, the thing about the ferments is that you have all the metabolic byproducts that the fermented foods are creating that are showing really good research of their benefits to our health. And so when you take a distilled, encapsulated probiotic, you're not getting any of those metabolic byproducts that are so beneficial. So I'm a big fan of ferments, but I don't tend to like the ones that are super sugary. I'm not a big fan of kombucha unless you like to drink your kombucha when it tastes like vinegar. And then it doesn't have a bunch of extra sugar in it. But I love kimchi, sauerkraut, home fermented. Yogurt is a little bit different, and dairy is just because so many people have trouble digesting dairy. But a really good, clean one. I like the Bulgarian yogurt they have here. That's one that almost everyone tolerates in reasonable quantities. So that's my preference. But some people just don't do ferments, don't have the time, or it doesn't work for whatever reason. And I do use probiotics. I tend to recommend them with meals. And I tend to tell people that if it's not refrigeration based, you should be pretty leery about its efficacy because those colonies, do dissipate. That's just, again, an opinion. And I tend to like a diversity of strains. So if you don't want to just get one strain, if you're going to use a probiotic, you want a mix, usually at least 5 or more. And a bifido and a lacto in there is typically, definitely what I'd at least want to see. And that's just a whole scientific realm and different situations for different amounts of probiotics, different types. There's all these nuances, but generally I'm the biggest fan of ferments. Yeah. So I'm going to talk to Amy about those questions. Seasonal eating, yeah, good one. I really like seasonal eating. I talk about it all the time, not in like a hardcore way, like it's like we got to talk about this every time we meet, but generally it really makes sense, right? Like, and this is a very, I would call this a much more like Chinese medicine oriented principle, this idea that we want to kind of, you know, eat foods that modulate our equilibrium in kind of context to the seasons. So like in the winter when it's really cold in our environment, warming foods are great. So that's soups and stews and, you know, those, and just again, like the foods that get created in nature then. So like winter squash, right? Really good thing to have in the winter. And maybe winter is not the best time to be eating a lot of freezing cold fruit smoothies and having lots of fresh salads and drinking fresh vegetable juices, like really cooling things. Whereas in the summertime, those are great foods to emphasize and be more, you know, prolific with. Plus, that's when they're growing and being harvested. So I mean, yeah, like my mantra about practicing in general is copy nature, right? And unfortunately, in the artificialness of everything about our world that we've kind of come to accustomed to, we've really lost the thread of the connection to nature and kind of how we've ancestrally evolved with nature. So seasonal eating is a very like good way to tap in and reconnect to that. And I think generally most people's bodies respond really well to that approach. I would say that all being said that people still have sensitivities, and just because, you know, bananas are tropical, so maybe that's not a good example. But oranges are in season in the summer. If you have a sensitivity to orange, doesn't mean it's great to eat it just because it's in season. So, you know, that's something to know for sure. Is that good with seasonal eating?
So I know you said plant-based diets, so what do you think about like increasing your protein content during the winter time?
I don't think that that's necessarily what I would ascribe to. I think that people's protein set point has to do with their lifestyle and their genetics, not really the time of year. I mean, to a little degree, like in the winter, if say like you live in a teepee, you know, instead of like in a heated house, and you're like just metabolizing more because you're keeping your body warm, then sure, you probably need more calories and probably a little more protein is good. But I don't think that really is seasonal related in my opinion. Yeah. So the cardio versus weight training and then versus general exercise. My thing about that is a blend is always good, right? It depends on what your goals and outcomes you're seeking are, but really we benefit from more like target heart rate sustained cardio exercise, which is a lot easier on our joints, but we also benefit from amplifying our muscle mass and the metabolic and health, you know, consequences of building our muscle mass. So I think that if both of those systems are balanced, if we overdo one or the other, we sacrifice. If we do too much cardio, we actually break down muscle. If we do too much weightlifting, we strain our heart. And we also like just break down our joints because it's hard on them. So in terms of the optimal ratios where you get to that, it's a very individual conversation with the person, and the things I would be considering are, you know, what is the problem with their health? What issues are we trying to tackle? What's their age? What's their genetics? Specifically, I want to know about their blood type because I think that, you know, O blood types are going to do better with a little more intensive weight training kind of stuff, and A blood types might do better with a little more cardio. And then kind of, yeah, again, just what the outcomes that are hoped for. So I really think it's a balance, and I think generally the older we get, the more we want to move. Well, I don't know, because keeping your muscle mass is really important too. So I think like the tilt might be a little more toward cardio, but again, that's kind of, it's really dependent on the situation. And in general exercise, I mean, I'm a fan of it every day. It's just, you know, it's about being in tune with your body. So we can exercise to the point where we're depleting ourselves, and that's